I've been sitting here listening very attentively to my colleagues on this debate, and everybody's been talking about hospitals, but not a single person has mentioned a patient and the astronomical cost that patients in our districts that each and every one of us represents are straddled with when it comes to hospital bills. Because in an emergent situation, nobody has the option to decide whether their doctor or their medical provider is in or out of network. So I think that we're missing the broader picture here, and it's that this bill really addresses the cost that so many families have to deal with. And let's be frank, this will bankrupt many, many families and many patients. And those of you that have experienced that have experienced instances where you have to go into the emergency room, you know what that means. So I'm no lawyer, but I am a nurse, and I read through the language of this bill, and I have not seen a single mention of any hospital. So I don't know where people are getting this from, but I did understand that there is a 60% carve out for those that take care of predominantly the indigent care pool, which is our Medicaid patients, those that are Medicare and Medicaid recipients, those that are underinsured, which means that a lot of the hospitals that serve overwhelmingly a poor population will not be affected by this piece of legislation. But it also talks about creating a dispute resolution. So if you are a patient that has insurance and you find yourself in an emergent situation in an emergency room, and you are out of network with the medical provider, then you have the ability to enter a dispute resolution where then those charges will be able to be negotiated with the insurance companies at a in-network rate. And if we look at the salaries of many of these CEOs, they go up to the millions and millions of dollars. So I don't foresee there being a huge fiscal impact on many of these hospitals if the payment, the reimbursement that they will receive under a dispute resolution would be an in-network rate.
Buckball, why do you rise?
For a question.
No. No.
The lady says she will not yield.
So I don't foresee that these medical institutions would lose an astronomical amount of money if what the dispute resolution or what the language on this bill talks about is them receiving an in-network rate that they have previously bargained for or negotiated in the first place. It just means that those individuals that find themselves in an emergent situation where they cannot pay or they don't have the option to choose an in-network provider, they will not find themselves with this astronomical bill. But I want to say something about Westchester Medical Center. And I do understand that so many years ago, they found themselves in a bankrupt situation. And the hospital that set forward a plan to bail them out of that was Montefiore Medical Center, which is the largest employer in the Bronx, but also takes care of one of the largest indigent care pool in the Bronx as well. And we have a population, Bronx County it ranks 52nd in healthcare outcomes in all of New York State. And we found one of our medical centers trying to bail out also Westchester Medical Center. So I think we need to look at this from the lens of the patients and of those individuals that we represent, because the hospitals did not vote me in here, and they did not send me here to speak just for them, but the people of my district, those people that are suffering every day, that have lost their homes because they have been straddled with astronomical medical debt, those were the people that voted for me.